All right, it's 3:01. Thank you very much. This is Mark Geiger with Bioness. Thanks for joining this patient experience webinar. Just a couple of housekeeping items. Before we get to the housekeeping items, I wanted to introduce our speakers. First, we have Felicia Hancock, who's a StimRouter patient formerly from Half Moon Bay up in Northern California, now residing in Tucson, Arizona. Who'll be speaking. Moderating this session is Dr. Eric Grigsby, who's not only the Chief Medical Officer of Bioness, and he's also Chief Medical Officer of the Alfred Mann Foundation down here in Southern California, and is a luminary in the world of interventional pain and neuromodulation. He's worked for 30 years as a clinician, taking care of CRPS patients, among other chronic pain conditions. And so we're very lucky to have both our speaker and moderator here with us today. Just if you have any questions, a housekeeping item, on your toolbar at the top, there is a button that says More. If you click on More and then click on Chat, then you can type your question in, and we will have visibility to those questions. Dr. Grigsby will be assembling those questions because a lot of them will likely be of the same texture, and then at the end he will, as moderator, ask Felicia those questions. So please do not hesitate to type any questions throughout the presentation, and we'll be accumulating those. So without further ado, I'd like to get started. I think Dr. Grigsby wanted to say a few words before we turned it over to Felicia.
Hi, Mark. Thanks, and welcome everybody, and welcome Felicia too. Felicia and I've had a chance to do this a couple of times, and I've spent as Mark said, I've spent my entire career taking care of patients with chronic pain, and a large number of patients with CRPS, or complex regional pain syndrome. And for a lot of years, we struggled with the right treatments, with oral medications, injections, sympathetic blocks, and various things, and then implanted spinal cord stimulation systems. And this peripheral nerve stimulation system that the engineers and team at Bioness put together has been a really nice advance for us and for our patients. And it's much less involved than the traditional spinal cord stimulation systems that many of you might be aware of, or maybe some of you even have, and has been really nicely effective. So we found a really good system to find the soft spot between being too complicated but still effective. And the so-called StimRouter system, which is our peripheral nerve stimulation system, seems to be a really good tool for our patients with nerve pain, including CRPS. And Felicia Hancock, Felicia, I want to turn it over to you. She is a patient who struggled with this challenge, and she's going to tell you about her experience with the problem of CRPS, and then with the StimRouter. So Felicia.
Hi, Dr. Grisby. Hi, Mark. I appreciate you guys inviting me. And to those of you who are out there listening, please feel free to ask any questions. This is going on a 2.5-year process for me, and I've had a lot of experience. So let me first introduce myself. I'm a retired police officer now. I was a police officer for 15 years with the city of Menlo Park. And the last 3 years of my career, I was a motorcycle officer. Which, by the way, is the best job in the world. And on July 11th of 2016, I was working on that Harley that you see, and I was going to write one more ticket before going to lunch, but unfortunately the driver I tried to pull over decided not to stop. The long story short is he ended up being a drug dealer and was on his way to school to deal some drugs, so he didn't want to stop and talk to me. He crashed, and subsequently I crashed. My motorcycle hit a curb. I went over the handlebars and through the windshield and into a light pole, arm first, to try and protect my head. Unfortunately, what happened with that was, while the rest of me was fine, I actually ended up breaking my arm. My right distal radius was fractured in 4 places, and the right ulnar styloid was fractured in 2 places. So basically both arms and my forearm were fractured in multiple places. And if we go to the next slide, you'll see what it took to put my arm back together again. So I now have a plate and 10 screws on my right arm. and the ulnar bone they left to heal on its own, hoping that it would solve our problems. And while the surgeries fixed the broken bones, what they didn't realize until later was that I had CRPS as a result of some nerve damage along the radial nerve in my forearm. I went through 52 PT sessions trying to get my right arm to respond. They prescribed oxycodone and hydrocodone for the pain, but as you can see from that picture, the result was in January of 2017, they realized that I had complex regional pain syndrome, and my right arm was actually so swollen that I couldn't wear my clothes anymore. I actually had to wear my husband's shirts because it was the only thing that my arm would fit through. For those of you with CRPS, you realize it's very personal. It's different for every single person, but my symptoms were the alligator type skin. I had really excessive hair all the way up to my knuckles, and it felt like an ice pick sticking in my wrist while a razor blade was slashing my skin while some gasoline was on fire on top of my arm. And it went from the palm of my hand all the way down to my elbow. Once they realized I had CRPS, they put me on gabapentin, which worked shortly, but eventually stopped working. And they actually had a doctor prescribe a compound medication specifically for me to try and resolve some of the CRPS issues. While we were dealing with all that, I was introduced to Dr. Oddest at Stanford Pain Clinic, and he is the one who actually discovered the nerve damage. And we first did a nerve block on the damaged nerves in the right forearm and realized that actually was helping. But unfortunately, the block, which should have lasted 72 hours, lasted about 8 hours. So I went back the next month and we did a nerve ablation. And while that worked for a short period of time, it didn't last as long as it was supposed to and actually flared me up again. And while I was talking to Dr. Oddest, he told me about the Bioness StimRouter, showed me some information on it. I went home, did some research on my own, and realized that this StimRouter was the solution that would get me off of pain medication. At least that was my goal. I wanted to stop taking medications and go back to work. And so we scheduled the appointment, and I went in, and the procedure took 30 minutes. It was so fast. When you walk in, they prep you, you go in for your procedure, you're awake the whole time. Actually, we had a great conversation about movies, country western music, and the differences between Texas and California while Dr. Oddest was doing his thing. It was actually kind of fun. It was probably the best experience I had of all the medical procedures I'd been through over the last year and a half. I went back, if you look at the picture, that's my StimRouter. It's the size of 2 large Band-Aids and has a battery box on top of it. And that's literally all it is. If you look to the left of that, you'll see 2 little tiny marks on my arm. And those are 2 little holes the size of a pen top, a pen that you write with. And that's all that's left after the surgery. Today, it looks like I have 2 little freckles on my arm, and that's it. When I went back for programming, because they will program your StimRouter specifically to your needs. So you can tell them what kind of pain you're feeling, and if you want it stronger or softer or faster or slower, a flutter effect, a pounding effect. And what that does is that puts an electrical sensation on the nerve that's damaged, that is flaring up. So your nerve is constantly thinking it's in pain and constantly thinking it's got to resolve that pain, even though all the problems are fixed. And with that electrical pulse, it distracts you from the pain. As long as my electrical pulse is just slightly above the pain level, I feel the electrical pulse as opposed to anything else. The great thing about StimRouter, it's as easy as plug and play. It's literally a Band-Aid with a box. You peel it on and you peel it off. There's a small wire that actually connects to your nerve that goes up to just under your skin. You can't feel it, you can't see it, you don't even know it's there once it's implanted. And you put your battery over that electrical wire, you push a button, turns it on, and you are good for the rest of the day. When I first started using this, literally the first day they pushed the button and turned it on, I went from the pain of a 9 to a 4. It was so much relief. I almost cried on my way out the door. I walked in at a 9 and I walked out at a 4. They tell you when you first start not to use it all day. They want you to use it for an hour and then stop, and an hour and then stop. That's simply because of the gel that's on the pad that sticks it to your arm can sometimes irritate your skin. Honestly, I used it probably 18 hours a day for the first 2 weeks that I had it. Never had a skin irritation at all. There was one day that I actually did move it over a little bit just to give my skin a break. But otherwise, I was using it, and within the next day of being programmed, I was taking myself off of all pain meds, and I haven't touched a pain medication since the day I was programmed. And that was my goal, because I wanted to go back to work. And this allowed me to actually go back to work. We placed it in a position to where I could actually put my uniform shirt over it and go back to work, and nobody would even know that I was wearing it because it's so inconspicuous. When I first started, I used it 15 to 18 hours a day. But the thing is, there's a residual effect. So after a while, you don't need it as much because your brain constantly focuses on the sensation of the electrical stimulation. So within 6 months, I was using it 2 to 4 hours in the morning, could go for 6 hours with no pain whatsoever, and then turn it on, and then go back at home, and I would turn it on for 2 to 4 hours again before I went to bed, and I could go to sleep and actually get a full night's sleep. I used to have to sleep without my hand under the covers because anything touching my hand would irritate it, and I was getting 2 to 3 hours of sleep a night. I went from that to a 6 hour a night sleep within 6 months and was actually back to normal again. Now I'm 2 years out, and what I do is I use it on an as needed or active day basis. So if I do something that irritates it, I plug it on, and within a few seconds I have relief. Or days that I know I'm going to be particularly active, like I've gone back to my regular life. I actually got my life back. I didn't want it changed. I wanted it back. And what my implant allowed me to do is go back to my life. I want to go scuba diving, which I did. That picture is actually from September of 2017. After my implant, I used to have to shower outside with my hand outside of the shower so that the water wouldn't touch it. Now I'm scuba diving and swimming all the time. I'm back on my motorcycle and I can ride all day. I just know that if I'm going to be riding, I put the StimRouter on in the morning to get that residual effect, go riding all day, come back, put it on in the evening. Or if I want to, and I'm going to take a weekend trip on the motorcycle, I take it with me. It fits in my pocket, quite frankly. So it's something I can carry with me anywhere, everywhere, no problem. I go hiking. I used to have to wear my husband's shirts or short sleeve shirts so that nothing would touch my hand. Now I can wear any clothes I want. In November of 2017, I actually got married to my husband. And that day, when he first proposed, we thought I was going to get married and never be able to hold his hand again. And the day we actually got married, I put the StimRouter on in the morning. We planned an afternoon wedding so I could wear my StimRouter for 4 hours in the morning. Took it off, went, got married, held his hand during the ceremony, went and danced with him all night long, had dinner, shook everybody's hand, gave everybody's hugs, and never had to give it a second thought as to what was going to happen to my hand or my CRPS. I've recently gone back to weightlifting again, which I didn't think I was ever going to be able to do. I'm working on my PhD. That requires a lot of typing. Before, I could only type 5 to 10 minutes at a time and would actually have to walk away for hours simply because of the motion would stimulate the irritation. Now I can spend all day, in fact, did spend all morning this morning working on it. One of the things I did as a police officer was working with older adults. And I want to get back to volunteer work with them. And as you know, older adults like to hold your hand. And I can't say, no, that hurts. That's not an option. And now I can actually go hold their hand and work with them. Basically, any limits I have are my own imagination. I wake up every day and I don't think anymore what I can't do. I just wake up during the day figure out what I want to do and go do it. And if I need my StimRouter, it's always there with me. One of the things that they'll also tell you is when they implant the lead, it can be taken out later if you need it to, but I just opted to keep it in forever. It doesn't cause any problems. It doesn't get in the way of anything. I don't even know it's there. But say something happens 5 years from now. You all, if you have CRPS, know that it only goes into remission. It never goes away. It just goes into remission. So 5 years from now, if I'm in another motorcycle accident, or I like to hike, and say I fall on my wrist the wrong way or my hand the wrong way, well, guess what? All I have to do is pull out my box, pop on my battery, and turn on the machine, and I'm good to go. I have a solution for the future that never involves another pill again. So that's my story, and that's my experience with StimRouter. And if anybody has any questions, I'm more than happy to answer them.
Thank you, Felicia. I just wanted to jump in. This is Mark again from Bioness. Is that while Felicia has a radial nerve implant on her arm, as you saw in one of the earlier slides, the StimRouter is approved for chronic pain of a peripheral nerve origin. We have 19 different nerves stimulated in our clinical study, and now commercially since 2016, 26 different peripheral nerves have been stimulated. I need to stipulate that we're in the United States, we're approved for chronic pain of a peripheral nerve origin with the exception of pain in the craniofacial region. So pretty much anywhere from the neck down, upper extremity, torso, lower extremity, we are approved as long as your doctor can identify the named nerve that's causing the pain signal. Felicia, one question I had that we seem to get from a lot of patients is, what does it feel like when you turn it on?
Oh, yeah. Actually, I've gotten that question a few times. So I'm not sure if anybody out there has ever used a TENS unit, which is a little electrical stimulator. It's the pads that go on your skin, and it gives a little pulsing sensation to your muscle. And that's kind of what it feels like. But instead of feeling it on your muscle or on your skin, you actually just feel this little pulsation in your arm. So it's not distracting in any way. Actually, it's kind of like a happy little massage on the nerve and inside your arm. You can actually feel it traveling down the nerve. And it almost feels like somebody is taking their fingertips and just gently pulsating the nerve from the location of the StimRouter in the direction that that nerve flows. So it's not just the local spot where your implant is, but it actually can travel down the nerve. So where mine is implanted is actually on my bicep, a little bit behind my bicep, but I actually feel that sensation, that little fingertip pulsating on my nerve, and it goes all the way down to my thumb. So you just kind of feel that little tap going on, but it's just enough to get you over feeling any of the pain sensations. And that's really all you want. And when they program you, they work with you to get that happy spot. So they don't just, it's not one program fits all. It's not everybody's going to feel the same thing. When you get programmed, they're going to find out what feels best for you and at what level it feels best. So you can have up to 8 different options of pulses at varying frequencies, so varying speeds, and it can last, they can program them to last for an hour. I have a program that lasts for an hour. I have a B program that lasts for 4 hours. I have a C program that lasts for 2 hours. So I also get to select how long I want it. If at the end of those hours I need more, I just turn it on again and it goes for that period of time. And all I feel is that little tapping feeling or TENS unit feeling, but it's actually in my arm on the nerve and I can feel it traveling.
Thank you.
Felicia, the other question, kind of a follow-up on that is, do you feel it anywhere else?
No, not at all. And that's
just where you need it.
Just where I need it. actually. If I want to feel it somewhere else, so I have the option, you know, it is movable. It's not stationary like a neuro or a spinal cord stimulator. It is where it is. It doesn't move because it's implanted in you. Well, this, I can move the battery around a little bit. So if I need a stronger sensation, there's a place I can put it to actually where I can get a stronger sensation. If I need a lesser sensation, I can move it around to get a lesser sensation. I can move it right on where the nerve damage is. But it really only hits the area where that lead is connected to. So it's only feeling it on that actual nerve line. I don't feel it on any of the other nerve lines. It's just that one nerve line.
And does the patch is on whenever the patch has to be on, of course, whenever you use it? Do you have any I know, I'll just say from the company's perspective, we spent a long time making sure that the patch was as non-irritating as possible and that didn't stimulate any response. But from your personal experience, does the patch being on every day cause you any trouble?
No, not at all. It's like wearing a Band-Aid every day. That it literally, I call it my Band-Aid with a box. It's when you first start to use it, it is really sticky when the first use. So it requires a little bit of peeling it off of your skin and might leave a little bit of extra residue like a Band-Aid does. But then you can use it again the next day and the next day. And I generally get about 2 or 3 days worth of uses if I'm using it 4 hours at a time. There's some times where I've actually had the patch last for a week simply because I've used it less. As you continue to use it, the stickiness starts to go away. So what they do is they give you a box of a box at a time, and each box is set to be able to last you for the equivalent of 30 days. It's an estimate because the more you use it, like when I was first using it and I was using it all day, every day, I didn't take it on and off as much as I do now. So the patches were lasting longer. Because I take them on and off now more, the patches don't last quite as long, but it's so easy to use. If you look at you see the Band-Aid part that goes on the skin on the picture, and then the white box that's on top of that patch, they just pop apart. There's 2 buttons. You just unbutton it, get a new patch, button it on, and put it back on. It's actually easier than using a Band-Aid sometimes because the Band-Aid sometimes stick to itself. So from that aspect, no, I don't have any problems. It's easier than a Band-Aid. It just peels on and peels off, and you get a case with and each patch comes with cellophane, so you peel it off, you put it on the cellophane, put it in the case. When you're ready to use it again, you just open it, peel it off the cellophane, and stick it back onto your skin, and you're good to go.
Well, that's very helpful. And just for everyone online, this the StimRouter device, the peripheral nerve stimulation device, has a proper reimbursement through Medicare, which has a reimbursement for the physician in your surgery center or hospital for this device. And then if you have any particular insurance questions, Mark, do we have a resource at Bioness, and we could help anyone try to sort out the insurance question because they're so complicated these days. We have a lot of coverage under insurance plans, but do we have a way we could help an individual sort out whether it's covered by their insurance?
Yes, we absolutely do. Thank you, Dr. Grigsby. If you call either the direct phone number or the 800 number, we can put anybody in touch with one of our reimbursement experts to pre-authorize them or help them with the pre-authorization with their clinician once they get screened and their clinician tells them that they are a candidate for StimRouter.
Great.
And the other thing is,
all right.
Not to interrupt, but just to also let you know, if there's anybody out there listening to this who's on workers' comp, I know it can be a pain, but I actually got mine through workers' comp, and they were excited to do this. They reimbursed for everything simply because it was a one and done process. There was no having to go back and get pills and no having to go have surgeries later on.
I think too, I think all of the insurance companies these days are looking for opportunities to have our patients take fewer medications and need less future surgeries, and even the opioids, especially the pain pills. we're all trying to use them wisely and use less if we can. And I know from our internal data, we've been very successful. From our patient survey, we've been very successful in reducing the need for medications for our patients. So, which stands to reason if you can have less pain, then you need less pain medicine. But that also has a nice benefit to most of our patients. Right. Let's see. I have a question here from someone. At the time you considered the StimRouter device, Felicia, was there, just to review again, was there another device that you were considering at that time, the spinal cord stimulation or the implanted infusion pump?
I looked into those options, but within 5 minutes, absolutely took them out of consideration, simply because they are such invasive surgeries. I looked at the spinal cord stimulator and the fact that they have to implant a battery and run a wire down your spine. In fact, I just had a friend who did it. And unfortunately, she's having a lot of complications from it. And I looked at it for a very short period of time and realized this was with the Bioness StimRouter, it's one wire. There's no battery. There's no invasive surgery into the spinal cord. It was basically, and I'm not sure if people understand that the implanted lead and wire that they put in you is very small. I know you guys have the exact measurements, but it's only, I think, 6 inches long, maybe? It's yes. Really tiny. So all it has to do is touch the nerve. It doesn't have to go through your spinal cord. There's no internal batteries. There's no having to have parts replaced later, which requires another invasive surgery. With StimRouter, it was so non-invasive. I was told I would be in and out and awake the entire procedure, and it lasted 30 minutes. And when I heard that and compared that to the other options, I didn't even give the other options any more consideration. I did look at them. I was aware of them. And when I compared, I'm kind of one of those anal people that will take a piece of paper and chart things out and pros and cons. And when I did that, it was a very simple decision for me to go to StimRouter because I wanted to go back to work and I wanted to have my life back. And this afforded me that because it's literally stick it on or peel it off, and I can go back to scuba diving. I wouldn't be able to go back to scuba diving had I had the spinal cord stimulator. I wouldn't have been able to safely do the motorcycle riding that I do. My department wouldn't have taken me. Well, I don't know if they would have taken me back. I can't say for sure. But they had no problem with the StimRouter because once they learned it was simply just a wire implant, they were thrilled.
Good. Felicia, thank you. You know, I agree with you in terms of where this falls on the treatment plan. I've had the opportunity to help patients with several thousand spinal cord stimulation devices and implanted infusion pumps over the course of my career, pain pumps. But really, in any case where the StimRouter will be helpful, it's a simpler strategy. And we in the clinic, you know, we would use it first before spinal cord stimulation or the implanted pain pump, that's for sure. Well, I don't see any more questions. Mark, do you have any more comments? Felicia, anything else that you'd like to say before we wrap it up?
Oh, go ahead, Mark.
Yeah, this is Mark. Thank you, Dr. Grigsby. Thank you, Felicia. So, Felicia, what would you say to other people with chronic pain hesitant about an implant?
I don't hesitate. That would be my biggest first thought come to mind is don't hesitate. I live my life pain-free now. And I know that wouldn't happen without StimRouter simply because there are days that I'm in pain because of overuse, because I do go do things. I'm a very active person and I didn't want to stop being active. I'm not going to be the person that probably doesn't have pain for the rest of their life simply because I am constantly active and I will constantly flare myself up. And my simple solution is not popping a pill. My simple solution is putting on my Band-Aid with a battery and pushing a button and for an hour going about my life. I don't have to sit and wait for it to work. It works immediately. And once it's on, I still go back to my life. I go cook dinner. I go for a walk. I walk the dogs. I go to the store. I go grocery shopping, pain-free, even though before I pushed the button, I was in pain. So I would say don't hesitate simply because it's out there and available. It doesn't require a pill. It doesn't require a battery implanted into your body. It's simply the push of a button and you get relief.
Well, first of all, Felicia, I'm glad you had a good experience, and I'm glad you're back in action and doing the things that you want to do. And for all of you that joined us, you see you have a way to communicate with Bioness. Any of us would be happy to talk to you about your situation personally, about StimRouter in more detail. And you see all the information there on contacting us on your computer screen. And with that, I want to thank you, and I want to turn it over to Mark Geiger at Bioness for any last comments that you would have. Mark?
Nope. Yeah, thank you very much, Dr. Grigsby, and thank you, Felicia. There are many patients with experiences like Felicia with implants all over the body, and we would love to answer any questions you may have or point you in the direction of resources where you can gather more information to make educated decisions, or help you find a clinician that is aware of StimRouter and trained on its use, so you can be screened to see if you are a candidate for the technology. So please don't hesitate to reach out so that we can start the conversation. Thank you very much from Bioness and everybody involved. Thank you, Felicia. Thank you, Dr. Grigsby. And we look forward to speaking with you.